Evening. I'd like to call to order this regular meeting of the Verona Local Board of Health for April 17th, 2023. Madam Clerk, would you please read our Open Meetings Act compliance statement?
Act having meeting of the local board. The public meeting. At least 40. We held in New.
Thank you very much. Madam Clerk, would you please call the roll?
Here, Councilman.
Here.
Councilman.
Here.
Deputy Mayor. Here, Mayor Roman.
Here.
Mayor. Monica. Joe DR.
Very much. Would everyone please rise for the public pledge of allegiance? I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Very much. As far as introductions go, I believe our clerk has already made one. We, as the governing body, also function essentially in this secondary role, in this role as the local board of health. We have not met in this capacity in a while, but in terms of an evaluation of our health practice here in town and reconstituting this function of our government, I'm very glad that we're organizing this and that we are putting this function back on the table here. And this is a little long overdue, I would say. So, but I will welcome to the lectern, Amy Monaco. If you'd like to introduce yourself any further. And
okay, so I'm just curious, how long ago did you last have a local board of health?
don't ask.
No.
All things I've been here years.
Okay.
And I just said, whoops.
Okay.
But we're here tonight, and that's what matters.
Yes, absolutely.
Path of compliance going forward.
Yes. Okay, great. So just, I don't know if Joe shared anything about my background, so just a little bit about myself. I've worked in public health for over 20 years, in local public health for about 5 of those years. So my roles mostly before that were in research administration and research management, but not clinical trials, population health trials. So I worked in California on a large breast cancer epi trial, and then I was at NIH working again in cancer epidemiology. So before transitioning to local public health, that was, what I did a little bit more of. So I've been, most recently I was in Bloomfield and started in Montclair just 6 weeks ago, I guess. So go easy on me. I don't have all the answers yet, but I do know a lot about local public health in general. So tonight I want to talk to you a little bit about Montclair, the structure of Montclair, the services, that we're providing for Verona, and then more about just kind of how the local health department works. Because honestly, before I was working in local public health, I really didn't know all of the services that, we kind of do behind the scenes that people don't even know are happening. So I guess, so we can go to the first slide. So I wanted to show you, and this is just kind of what I told you I was going to talk about. So the next slide, this is, I don't know how well you can see it, our org chart. Did you get copies of the slides or, okay. So, and we have, under the umbrella of health and human services, we have other services that are specifically like Montclair specific, but these are the core services that we offer all the residents of Verona. So you can see there's quite a few staff that we're actually allocating just to all these core services. So myself, Keith Costello, whom some of you may have met from when he was acting. So he is the assistant health officer still. And then we have 3 divisions, and this is all required by state statute within the core services. So environmental, so those are the inspectors that go out, look at the restaurants, make sure they're in compliance. And I'll talk a little bit more in detail about that later on. So we have essentially Keith is an REHS, one of the health inspectors, as well as Steve and Bob or Robert. And then we just hired 2 part-time people using grant funding. We're trying to really leverage all the grant money that we're getting from the state to expand our core services. And we brought in 2 people that have that are bilingual in different languages to try to reach a larger section of the community. A lot of times the food handlers don't speak English, like the people really doing the work that we really have to make sure are following laws. And so we wanted to make sure we had some other languages available for those staff to really do trainings. So we're going to start to expand trainings among food handlers to do it in Spanish and English, as well as Arabic. So that's environmental. Then I'm going to talk about nursing, the other biggest division. So the nurses, of course, during the pandemic, did a lot of the contact tracing. We've always done contact tracing. It's just no one really knew about it because, it wasn't, as big of an issue. So that's one of their roles. So any lab reported diseases that are any diseases that are considered lab reported to the state that are required, the nurses have to go and they do a case investigation, and then if there's contacts, they need to follow up with them as well. So that's a big portion of their job, and we have several people working on that. We also have audits, immunization audits that nurses have to do for schools. Verona, I believe, is it 7 schools? I have the number somewhere. And so we do all those audits. Now, it's not just one, it's one audit, but we look at every chart. So the school could have 500 students, 200 students. We have to look at every chart every year to make sure they're in compliance. We've definitely found since the pandemic, compliance isn't as good because people got behind on their immunizations. So that's another key thing they do every year. Then we do things like clinics, outreach, homebound vaccinations. This started a lot during the pandemic, especially for seniors and people that just, were homebound due to illness or disability. And we've kind of incorporated flu shots now into that. So we're doing a lot more homebound visits as well. So those are some of the core things, but, the nurses tend to do a lot of other things that kind of come up as needed. And then health education is just that. We do health promotion, we do programming, and that's something I'm looking to expand a little bit more upon. Right now we're doing, I would say, like, we haven't had a lot of staffing in health ed. So I'm trying to expand that again with the grants and leverage that money for some of the areas where our services, could be stronger. So then on the next page or the next slide. So this is really our core leadership team, myself, Keith, Margaret, who is the director of nursing, and then Steve, the other assistant health officer. So if you need to reach out to someone, if I'm not available, any of these people, depending on, whether it's a nursing or environmental issue, these would be the people, you would connect with. Okay, next slide. So right here, it talks about kind of what every municipality has to have. So if you're not doing it yourself, you can have a shared service contract like you do with us. And so if you didn't have that shared service contract, you would have to hire your own full-time health officer, at least one nurse, one inspector, one health educator, or part-time health educator. Typically for a town of the size, you'd probably want, because you have quite a few restaurants, at least 1.5 RHSs. Again, maybe one and a part-time nurse, so 1.5 nurses. So by having the contractor saving a lot on the benefits and the salaries, and so that's why shared services has become so popular. And I think there's been more talk among mayors about kind of continuing to do this, and maybe even in areas outside of health. So I just wanted to kind of show you, like, this is the minimum, and then you could see from the org chart that we have that plus. And so since we're so close, if you give us a call, we're here right away. It's not like it's a different county or something. Next slide. Okay. So again, this is just if you ever wanted to read more about kind of what governs all of these are the practice standards for public health and health officers in New Jersey. that link would take you to the chapter specifically. So if you had a question about something, that would be the place to go. Okay, next slide. So the 10 essential public health services, just to give you an overview of, what is expected from a local health department. This is really a national model. Everyone gets to it in a different way depending on your state. But again, this is just, and this even, you can find this at CDC, but this is kind of the national standard. Next slide. And again, I just included some places. So if you wanted to read more about, who must have a board of health, this is the statute that governs it. So I'm not going to go into all the details. So I wanted to just go over some stats from 2022, and then we could look at this most recent quarter. So there's 53 restaurants that we inspect, and we do that once a year unless there's an issue and we have to go back. And this is, specifically Verona. There were 3 mobile food vendors, 6 pools, and we do it 2 visits a year, 1 before they open, and then again once they're open during the season. 4 schools, 1 daycare, and then depending how many lead cases there are, right? We had 1 in 2022. You could have 5, you could have 3. It just, it's going to vary. Pet shops, 2 youth camps. We had 1 in 2022. Site plan reviews. That again can be a lot of different things. Sometimes it's just a plan that we get. Could be for a restaurant. It could be sometimes like I know I was asking some of the inspectors, could be just for a deck that they want to make sure that there's no health piece involved. I'm not really sure why we're getting those. We might have to talk about that a little bit, but yeah.
Can I ask you a question?
Yeah.
Some of these statistics don't make any sense.
Okay.
Like we don't have 53 restaurants in Verona.
Okay.
You have 6 schools.
We have 6 schools. We have 1 pool.
So,
We have
7
at least 8 if you include TCI, right? We have
Mhm.
at least 3.
Okay. All right.
Yeah, and we don't have like a pet shop. We have pet grooming places.
Okay. So let me go
So
back.
some of these things are
Okay. So restaurants you're saying are
not 53.
more or
but
less.
that's what you count because like convenience stores get inspected as restaurants.
Okay.
Right. There's
yeah.
different risk types,
Yeah,
right?
there-
Grocery stores with food prep.
People,
Yeah.
places selling food to the public,
Right.
that does it get classed under a restaurant,
Yeah,
basically?
I guess more
Right.
specific, I was just curious about
Mhm.
the pool's numbers and the school's
Does
numbers.
the pools
Okay.
include, like apartment complexes and condos, or is that only municipal public pools?
No, public and private.
Public.
So I think there's 2 at the Claridge.
Claret,
Right.
yes.
Okay, so that's
No,
helpful
yeah.
information.
Okay.
And then for the schools, is that perhaps school systems rather than individual school campuses?
It should be individual schools, but so you're saying there's only the high school?
There's 4 elementary.
Schools.
Okay.
They do,
Our Lady of the
they
Lake,
have a private school,
Our Lady of the Lake,
that would be included.
the Children's Institute as well.
And then we have a bunch of preschools.
Bunch of preschools.
Okay, so I don't know why they only have 1 daycare. So let me check on those numbers. Again, I apologize, I
Are
didn't
these-
necessarily.
Are all these
Uh,
annually inspected or are some of them maybe on a biannual?
No,
inspection?
they should all be
All
annual.
the
They should all be annual. So this was for all of
So it'd be good to get,
2022.
Yeah,
So
if you could
schools and
update us, that
daycares.
would be appreciated.
Yeah, of course. I'll send an email. No
And is
problem.
kennel and pet shop, maybe pet grooming, because I think we do have 2 in town.
I think that both, right,
And
that
And there's
covers
tennis,
both. It's
there's
kind
the
of
Dutch
broad.
leaguer.
But the schools, yeah, I don't know why that's so off. I apologize. I'm not sure.
With regard to
Mhm.
daycare, is there a distinction between a preschool that's like part-time and like a daycare facility?
Right.
Because I think they are governed under different regulations, are they not?
Yes, I could have them more clearly defined for
Okay,
you.
that would be really.
Yeah,
helpful.
of course,
Thank you.
of course. Okay. And camps, does that sound right? That there was just 1 last year?
Well, one that Verona offers, but the
Okay.
schools offer their own versions, so yeah, that's
Okay.
another good
I mean,
clarification.
Okay.
Verona summer camps are, the rec camps are exempt from the statute, the inspection, but. I don't know, it would be the,
I guess the question would be,
Yeah.
what is the one youth camp that you're referencing?
Mm-hmm.
Because then that would maybe help to understand.
Right.
What else constitutes it?
Okay,
it's probably basketball.
Maybe it was the.
that's a rec camp or
There's a privately run.
privately run?
Right, summer program.
Okay,
Yeah,
all right, let me.
so there are various like public school and public recreation
Okay,
camps that we have in town.
That's actually just kind of a general good point, is if we can get basically the drill down list for each of these,
Mhm.
we can give it a good sanity check just to make sure that everything
Okay.
that's falling within scope is being properly permitted and inspected.
Right,
We'll-
right, okay.
We'll sort of know.
yeah, because if we don't, right, if we don't find out about something, then we can't inspect it, right?
Right,
It's
right.
We'll,
like-
we'll,
it's
yeah,
kind
we'll,
of-
we'll
it's
fill in
that-
gaps.
Yeah,
Well,
yeah,
that's why it's important to have this dialogue, so I
Right.
really thank you for
Yeah,
coming
yeah,
and
of
like
course,
this
of
gives
course.
us an opportunity to look at this, because I don't think
Right,
I would have
right.
ever known that you were inspecting some of these things until
Mhm.
now, let alone providing the site plan review, which I don't know if I had any familiarity with.
We get those at the planning board, actually, we do get.
Yes, I
that,
imagine that you do,
Yeah.
but I'm not on the planning board, so I haven't seen.
Right,
the
right. Well, it's more typical if it's a restaurant that we would do a
Mhm.
site plan review, but it sounds like we get copied on other things that aren't necessarily related. And I mean, we're happy to look at it, but typically it's not gonna be relevant, so.
Normally, they probably go to all of the enforcement agencies, and if it doesn't apply to the health department, they just initial not
No,
applicable.
okay,
Correct, right, I mean, it loops.
No, that makes sense,
Yeah.
so it's just, it goes around, okay. That
okay,
makes
it's just like a distribution list
Yeah,
that goes out,
that's it.
yeah.
Yeah,
okay.
that does frequently happen, so it's good
Okay.
clarification.
So the other things like complaints, right, that's pretty straightforward.
Yeah.
We had 48, rabies vaccination clinics, we have 2 a year, I think we used to do 3 a year, it sounds like, at some point, someone told me, but we do fall or spring and fall right now, I think we used to do one in the winter, right,
Yes,
okay,
with Cedar Grove.
okay.
Could you briefly touch on
Mhm.
what happens? So residents lodge this complaint, see
Mhm.
if investigated. What happens then?
Okay, right, well, I guess, so I think they usually go through Mary, first.
Right.
And Mary kind of like knows now, like, what to actually pass on to us and what's kind of not really a complaint that we can address. So, like, an example would be like, if there's an apartment building and the carpet in the front lobby isn't as clean as I would like it to be, she's like, no, that's not really a health complaint. So she kind of like, but if it is a valid complaint, that she can tell that's valid, then we would get a call, usually our front desk person, and then we distribute it to one of the inspectors. So, typically solid waste, trash on the side of the road that didn't get picked up, that can happen. Heat complaints are common in apartment buildings. I don't know, rodents, I don't know how big of a rodent issue there is in Verona yet, because it seems like they're kind of heading this way,
I'm
unfortunately.
surprised you only had 48 last year because there wasn't. a
Mhm.
problem.
Yeah.
Well, the
okay.
48 total complaints and all.
I know, I'm
Yeah.
surprised that's
Yeah.
very close.
Yeah. What is
Mhm.
essentially your time cycle of responding? Let's assume that there is a resident complaint that comes in, we pass it, we triage it, determine it actually
Right,
legitimately requires public health follow-up. How
Right.
long basically to accomplish an inspection, to issue any orders, et cetera, and then through
we
closeout?
try to go out same day.
Okay.
Right, I mean, and maybe if it's at 4:30 and it doesn't look like it's something that
It's
is
emergency.
dire, right, then, but we do have people on call as well, so we always have, there's an inspector on call, and then I'm always on call, so kind of those two happens.
And does no
Mhm.
heat actually fall in under public health, or is that code enforcement under our side? Or is
It's,
it both?
yeah, it's a little bit of both, so same in Montclair, like sometimes they handle it and sometimes we handle it. I can get some specific examples and tell you about them with heat, how it would work. So I'll get back to you on that too.
And I think Councilman Tambora's question was, so
Mhm.
after it's inspected, then what
Right.
happens and what's the line of communication back to Verona and
Mhm.
the person who made the complaint?
Right, I believe it goes back to Mary, but I'll confirm that as well. And so usually what we do is reach back out to the complainant and, say, this is the resolution, right, whether it was a summons, a notice of violation. There was really nothing we could do, it was kind of outside our purview. But it sounds like, usually there's something that can be done because Mary's kind of pre-screened them, so,
Okay.
If it's a summons, it's heard in Verona Municipal.
right.
And does,
Mhm.
and this is a question for Mr.
Mhm.
Diarco, then does
Sure.
Mary, she knows that if she needs to involve someone else in Verona in the issue, then she knows where to go to?
If it's not within the purview of the health department, she would refer it to the appropriate department.
Okay, like whether it be
That would be
police
the
or code
normal
enforcement,
process. Yeah.
okay.
All right, anything else?
One question about,
Sure.
so about the restaurants and food vendors.
Yeah. So I really should say food establishments,
Yeah.
I guess is
So
really.
so if
Yeah.
you find,
Mhm.
an establishment is not
Mhm.
meeting the health code,
Right.
do you offer them an opportunity to resolve it? Like at what point
Mhm.
would you shut down a restaurant
Mhm.
for violations?
Right. I mean, right, it has to be pretty, I mean, we try to work with the restaurant, right? Because we don't want to, have them lose business. However, on the other side, we have to protect the public's health. So if it's something small, like, I don't know, maybe something I'm trying to think, because I'm not an inspector, so I'm trying to think what, what they've usually told me. Minor things, like they're not keeping a log of how frequently they're changing, looking at their grease trap or something. That's not something that we're going to shut them down for. We're going to say, listen, make sure you're doing this. We'll come back and check. Do you all know what a grease trap is?
Yes.
Okay. So, something like that. But we would note it in the report, and then that would be something we would, kind of highlight and make sure is addressed. If it's something more like temperatures, right? Like the walk-in fridge is not, or freezer is not at temperature, then that's going to be much more serious. And we may, have them throw out the food and say, until you get it fixed, so that, those are kind of like the two ends. But typically, I mean, we don't have that many where we close them down. It's more conditionals. And then we go back and give them like 2 weeks and we'll say, okay, we'll give you 2 weeks, get your plumber in. Sometimes because of like supply chain issues, although that's gotten better, maybe we give them a little more leeway, that sort of thing. But typically Verona hasn't had a history of, really egregious.
Well, that's good.
Yeah.
Because we all tend to eat.
You could still eat
Yeah.
that,
Yes.
Yeah.
And how does that get communicated back
Mhm.
to where the Board of Health? But I haven't seen any notices of violations or any details of complaints or whatever.
Right.
How should that be reported back to us?
And that's why we're having your Board of Health meeting.
Okay.
Yeah, and structuring what should be coming back to us. If you had
Mhm.
an egregious violation, the health department would send it up to my office for your attention.
Mhm.
Anyway, they're still posted conditional satisfactory and
Mhm.
satisfactory inspections. The public would see that violation reports would
Mhm.
come up here if it was serious and egregious. I'm sure the health officer would call me when I had interacted. But that process, I haven't seen any of that myself.
Mhm.
Okay, so
Yeah.
we wouldn't have a lot of big issues. As
Mhm.
in addition to being the Board of Health,
Mhm.
in 35 minutes, we're members of the town council.
Right. You do it, right.
And we are contacted by residents for all sorts of reasons,
I
so
understand. Mhm.
I feel like we tend to do our job really
Mhm.
well when we have the most information
Sure.
possible, so
Mhm.
as far as getting that out, even knowing that everything's good
Mhm.
is helpful,
Mhm.
and getting a little information away is great.
Well, I do want to commend the fact that Keith,
Mhm.
who was running things before, and
Mhm.
Joe have worked together
Mhm.
on these reports. I mean, the report we're going to review tonight
Right.
has been provided to the council since Joe's arrival, and so
Mhm.
it's been great to see all the satisfactory.
Right, well, I was gonna say, right, so that you'll get that monthly, I guess, right, Joe?
Yeah.
You're conveying that.
We've already been receiving essentially the activity reports of the department as part of our regular
Okay.
management reporting package, which is something that Joe has been very good at getting to us, and that's helpful.
Right,
We are aware of the activities of the Montclair Health Department
Okay.
and so on. It's
right,
in the formal reporting process, I think, is a significant improvement to us.
Good.
We know that the function is being carried out, but for us to provide the appropriate oversight, this is.
I'm just looking more if
Sure.
there's an issue.
Right.
I mean, this system
Mhm.
information's been great,
Mhm.
the education has been much improved.
Right.
since we are communicating. I'm just looking at, okay, if there is an issue, like there's a complaint
Mhm.
of substance that we should be aware of,
Mhm.
because when people, if their building doesn't have heat, after they call the health department, we often,
Mhm.
will.
You'll
get
hear about it
communications
from the
about
other
things
side, right.
that it would be helpful to know that we can say, okay, health department's already working on this, or
Mhm.
we need to call, or, let's figure out. something.
Right, okay.
But no, this is very helpful information, and it's been great to review it.
Is this something where maybe we want to basically say if an order or a citation or something is issued, some sort of formal notice by the health department that we should be notified as, you know, as soon as that's issued? Other than that, seeing sort of the all clears as part of just the regular reporting is probably a good process.
Okay.
And I should advise you, Amy, Keith was attending staff meetings, Amy is attending now.
Right.
And if she's not available, when Keith comes, so you do have that representation at our staff meeting.
Okay, great.
So then we decided I will let the township manager know and then he'll communicate to all of you.
Correct. Anytime that there's a formal action of the department
Right.
or a notice to someone to.
Okay, that's easy enough.
We want to move on to nursing?
Yes. All right, so, you know, as I kind of mentioned, you know, there's major responsibilities and required responsibilities include these audits. So here, so I wonder now, do I have the right number of schools here? I think I have.
Yeah, that makes more
Seven.
sense.
Yes, that makes
Okay.
more sense.
All right, so nursing knows what's happening. But, all right, so 7 schools, 5 childcare centers. Does that match up as well? With that?
It's school missing.
One,
TCI is still not right.
is that public or private? though?
Right.
Right.
It's possible we don't oversee the private sometimes.
There's 6 public and you show 7 schools. There's 6 public and
Okay,
6 public and 2 private schools. One is religiously based and
Okay.
one is for
Mhm.
more diverse and
Okay.
disabled. So it's right on the border of Montclair.
Right, right.
Spectrum 3, is it TCI? or
It's Spectrum 360.
Spectrum
It was
360.
TCI.
okay, all right. Yeah, so let me sort that out and see. I just know in other places I've worked, sometimes private schools, you would have a non-public school agreement with them through the health department. So I'm wondering if maybe we have that with one of them, but not the other one.
I think this is again where we sort all this out into a list and this way we can provide that.
Yeah.
guidance to make sure that everything's being covered.
Right,
Would it have anything to do with the size of the school?
it shouldn't, yeah. All right, so, you know, obviously the last couple of years, COVID was, you know, a lot of the case investigations. I mean, for a year, we probably didn't see anything but COVID coming through CDRSS. I'm not sure if you've heard that acronym before. So CDRSS is the Communicable Disease Reporting and Surveillance System. So that's where the labs dump their results, and then depending upon it, whether it's a reportable disease to the local health department, they get sorted out by sort of jurisdiction. So we would see under Montclair, Verona, Cedar Grove, Montclair, Nutley. So that's kind of how CDRSS works.
And I'm sorry, excuse me, so before COVID, or
Right.
what was the
Mhm.
communicable diseases that you would see?
Right,
And
right.
how frequent were they?
Yeah, I mean, it's like you would see maybe a couple of Lyme disease cases, occasionally, I'm trying to think, whooping
Like
cough. or-
meningitis?
Occasionally, but not too often. Hepatitis B, a lot of Hep B. Often though, not new cases, but cases, that people have known about, but every year when they get tested again, it comes back up. So there's like no really action needed on that kind of case. Flu, especially, and we don't do anything with adult flu in terms of follow-up, but pediatric cases we do. We don't handle locally. STDs and TB are handled by the state. So that's not something that comes through to us. Just lots of random like foodborne illnesses and GI like norovirus, Campylobacter,
E. coli?
E. coli, yeah, any of that kind of
Okay.
stuff. Right. So, and that's when we would, if we start seeing a pattern, that's when we might wonder, right, is this happening from a local restaurant or, and then you kind of, you look for common links. So one thing, back in, I guess, the end of February, right before I started, there were some wrestlers. I don't know if you remember. So I don't know if it started in Montclair or Nutley, but it was like Nutley, Verona, Montclair, that had skin infections. I don't know if you remember this, Joe. Yeah. And yeah, you do. So that was like, kind of interesting how, across jurisdictions, and they did a lot of investigating about, where it started, were they having the same symptoms? Was it the same? It turned out it was probably a herpes virus, and then some of them had secondary infections. A couple of kids were hospitalized. So, I mean, luckily everyone seems to be okay, but yeah, those are the kinds of things that will come up. Legionella is another thing that, people think like Legionella like doesn't, but we get Legionella, fairly frequently. Especially in long-term care facilities, that's where it's a big concern. And then the state really steps in and handles that from there. So yeah, measles once in a while, and that's when you really have to, jump in and make sure you're contacting everyone that was with that person. So yeah, it really runs the gamut. But a lot of GI, I would say, and flu, Lyme. All right, so let's see. So the vaccine for children program, I don't know if you're aware, these are state programs that, so they provide all the vaccine to the health department. There's one for children that a lot more people have than the adult one, but we actually have the adult program as well. So these are like traditional vaccines like MMR, polio, et cetera, for, underserved or underinsured folks. And so this is something that if there were people from Verona that needed it, they could come to Montclair and, in our clinic, and we could do the immunizations. A lot of times now, FQHCs, federally qualified health centers, are offering a lot of this. And so we don't have as much of a need, or people don't have as much of a need, because they have kind of like a home now for, kind of all their medical needs. So we're still doing it. I mean, there's definitely some need, because some of the federally qualified health centers don't actually do the immunization piece. I'm not sure why, but it just seems like they don't. It's a lot to manage, frankly. You have to keep the temperatures like really tight. And if you go like, a couple points out of range, the state gets very upset. So anyway, it's a pretty intense program to manage. But we still do that. And so, we feel like there's enough of a need that we don't want to stop it, because a lot of people have gotten rid of their programs, of late. So then lead cases, we kind of come at it from two angles. The environmental angle, where, the inspectors go and look at the facility or the home to see like what might be suspect. And then they'll do some testing with these XRF, these lead machines. And then the other piece is the case management. And so the way we get notified about them, again, is through CDRSS. It used to be a different system. And if there's a child who gets an elevated blood lead level when they're either 1 or 2 years old, that's typically when they get tested, we'll get the notification. So right now, the number is 5, is it mils? So I'm trying to think what's the, and it's going to go down to 3.5 very shortly. And so, which will probably end up, we'll have a lot more cases. So there were only 5 in Verona, which actually is a, for a suburb, it's a pretty significant number, but, of course, Newark, there's hundreds of cases every year. So we do the management where they're followed. And of course, it depends on how high the lead level is. If it's, lower, usually, we can identify some sources and it gets remedied. Sometimes it's even in spices that maybe they've bought when they're traveling. A lot of spices are known to have lead from certain parts of the world. A lot of times it's just, chip paint on windowsills, and then we try to, get them to remediate. And we try to link them to sources that can fund that, because it's expensive sometimes, depending on the extent. So the homebound visits I was talking about, there were 3 last year. So it's definitely, dropping off, not as many, as during COVID. They were sort of the height of COVID. So that was just the 3. And then outbreak management, we do all the time. This is even before COVID. I would say, again, flu and norovirus were probably the main things, maybe strep, but mostly flu and norovirus. And again, it was pretty busy in the fall, I would say, of this year, but that's quieted down now.
So is there ever a point that you would actually consult with the school system or daycare and suggest that they close for a period of time?
Well, so in 2020 and 2021, when the guidance from the state was different, like it evolved, right? It kept changing. And so at that point, I was in Bergen County at that point. I was the manager for communicable disease. So we had 37 towns that we worked with. So it was a lot of schools. And yeah, we were closing schools, frequently. I mean, we would make the recommendation and it was ultimately up to the superintendent. But, at that point, we were following the guidance when the threshold for closing was much lower. As things went on, then, they kind of made it a little, less, it was more flexible as things went on. So,
But on flu and norovirus, like even.
norovirus sometimes, flu, less so, but I've definitely seen it with norovirus that sometimes, they'll close even for maybe a day or so just to kind of like do deep cleaning, maybe if, like a Friday, and then they have the 3 days to kind of like really sanitize the school.
Yeah.
I personally
Like
haven't,
imagine a
but
daycare center.
yeah, right. Yeah. But once it even gets into a school at all, I think it's hard to, you really have to clean with everything with bleach. It's like a cruise ship or something where if you don't do a good cleaning, yeah. I mean, but long-term care facilities, I mean, you could have 80% of the residents get sick. I mean, it spreads that
It's
easily.
devastating.
Yeah. So, and then the chest clinic for TB, that's something we offer in our clinics in Montclair for mostly latent TB. If we have an active case, we don't see them there. We send them to the Lattimore Clinic in Newark. But it's, you'd be surprised how many people still have TB here in the US. It's not, tons of people, but honestly, I wouldn't have thought it was even as many as we see. So we do have that as well. And a lot of times there's a system in place where refugees coming in from other countries, like the Ukraine, for instance, the state has a program now where they actually send them immediately for testing. That's kind of like the gold standard. They give them this one blood test, quantiferin gold, to see if they're positive, and then get them on treatment right away. So they're trying to work with that particular group. So health education, I talked a little bit about it. So there's really different components to health education. So there's kind of the health promotion piece, which is like teaching healthy behaviors. The programming piece is more about, like maybe chronic disease self-management program. There's a program through Stanford that we've gotten some of our staff trained on that teaches a 6 to 8 week course. A lot of times seniors like it, but people with chronic disease, it's pretty popular among, and it's something that we're looking to expand. We're also doing mental health first aid training because mental health is such a huge issue, especially among teens. And so there's a program where you teach teens the course, and they can kind of be on the lookout for their peers that are having mental health issues. Like, to me, that's like one of the top priorities right now, I think, after the pandemic, especially.
So on that, do you work with the school system?
So we're gonna
offer that too.
So we're going to start to work with the school systems to try to, we're getting our staff trained. All the nurses are trained now, our health educators trained. So that's something, it's like on my, I've only been here 6 weeks. I haven't done it yet. I have a lot of ideas.
Training before, it's
Have
actually
you?
very good, and
Okay.
I highly recommend everyone to take it.
Yeah.
It's a really good program.
To kind of fill in the gaps here a little bit.
Sure.
A little while ago, the deputy mayor and I went
Mhm.
through a fairly comprehensive project to
Uh-huh.
look at the state of public health and wellness within the township.
Okay.
Trying to evaluate services that we
Right.
offer, things that we need.
Mhm.
So we actually do have some internal reporting and strategic planning on our own side as
Okay.
to
We can share.
right, that you
Okay,
obviously
great.
should be very well aware of, and of the areas where we thought would be priorities. And
Mhm.
one of the things that we looked at was sort of
Mhm.
also internally first response of,
Mhm.
if someone has a public health issue of some sort, whether it be mental or anyone else in any
Mhm.
other form of risk, to make sure that we have the ability to appropriately escalate and,
Right.
get them the right resources and so on. So there are a lot of different educational
Mhm.
items that fall under that umbrella,
Right.
but that
right.
was, something we did.
Yeah, I mean,
Mhm.
one of the gaps we have identified is just when someone is in crisis,
Right.
whether that be a
Right.
child or an adult.
Mhm.
And it's such a sticky
Right.
situation, and some, they come in from all different angles.
Okay,
Sometimes Mary Farrell's aware, but sometimes they come in through the police.
okay,
Or
right,
sometimes the school system. So I mean,
Mhm.
those are, and a lot of times it also, it really requires a social worker. Which
Right,
we don't
which-
have, but also it sounds like you don't have either.
we're hiring one.
Oh, you're hiring.
Yeah,
Great.
the council just approved it and, it's gonna be, it was predominantly the seniors, that really wanted it in town.
Mhm.
But I see it as being much broader, working with the police, doing like a police social work kind of program. I mean, we only have one for now. She's gonna be busy or he'll be busy, but, you know, when they start, but, I think we need more social workers, not just
Yes.
one. I think we need a team of social workers.
Yeah.
Right, in terms of just sort of the discovery of the need, that this is the reason I bring this up is because we've been
Mhm.
through this very recently.
Mhm.
Of asking all the questions internally, where do the calls come from, what are the
Mhm.
issues that we're dealing with?
Right,
So, you know, even though we're smaller than Montclair, we still are probably a pretty good test cases to,
Mhm.
you have to look at some of our
Right.
studies, some of our findings and,
okay,
you know, this,
yeah,
yeah,
I'd love to say it.
yeah, we'll pass that along to you.
And
Right,
also
right.
we use a
Mhm.
lot of publicly available data that you also have,
Mhm.
which is the Essex County Health Survey, which was great.
Right, right,
Which I'm sure you're intimately
Right,
familiar
right,
with,
uh-huh.
and then also New Jersey Department of Health
okay,
information. So
Mhm.
we'll send over our presentation that summarizes everything
okay,
and what our short, medium, and long-term goals are, but the issue is always time,
Mhm.
like people time.
right, yeah.
So, you
Right.
know, as much as we could collaborate,
Mhm.
that would be great, because again, we're short-staffed as you are.
Right, right, okay. Yeah, in fact, I don't know if you're familiar, Bloomfield actually had a great social services, social worker program. So they did start doing a lot more work with the police and they had, I guess they had 4.5 social workers, so that's like pretty significant amount of, you know, social workers. They found that like police calls went down because they were able to, like, you know, you'd have repeat callers basically. And so it cuts down a lot on police having to go back out, but not only that, you're actually getting the resident the services they need instead of this like vicious cycle of, you know, they call, they get a short-term fix and,
Yeah.
you know, so, you know, they're, you know, finding shelters for people, they're linking them to all sorts of resources. So, you know, I think it's an important piece. Have you considered hiring a social worker for Verona? Is that?
That's where it's too
Mhm.
cost prohibitive,
Okay.
and, you know, we were working with the county to
Right.
see if the county was interested in
Mhm.
hiring where we could tap into a shared service.
Yeah,
For
yeah.
example, the schools had, I believe, a service, an outside
Yes.
contractor that they were
Mhm.
using. But one of the things that we found was
Mhm.
it didn't cover the entirety of the population needing services.
It was kind of
Um,
limited.
Right,
to-
it was limited and there were, you know, there were adult
Mhm.
children that were, you know, with their parents
Yeah.
or seniors or other. It just didn't cover the entire broad range of scope. So
Right,
it's great that we have it, but it's not a, you know, it's
yeah.
not a complete solution.
I mean, I think every town should have a social worker because I think like it's just not the same as, you know, it's great to have all these other resources, but there's nothing like having, you know, because that person then will be the one, I mean, someone still has to reach out to these resources,
Yeah.
you know, whether it's adult protective services or.
Well, maybe, and since you cover
Yeah.
multiple towns, that could be something in the future that could be discussed as like a shared
Mhm.
service where
Mhm.
from Cedar Grove and not like a chairperson,
Mhm. Right.
you know,
Yeah.
as you look to expand, maybe that's something
Mhm.
that could be in the next.
Right, right.
It's something I know personally I've long wanted for, but again, we have to be realistic with
Right,
budget and also hiring. So we've
Mhm.
heard this job market's very tight
right,
to
right.
hire social workers right now,
Yeah.
especially post-COVID.
Yeah, yeah, right. Any mental health provider, right. It's okay. So we'll go over the reports, the first quarter?
Yes.
Okay, so I made some notes since we started talking, so there's probably things I'm gonna be taking off the report, but just some roads and things. So basically, right, I kind of gave you the idea of what the different risk types are. So this kind of goes to the earlier part of the conversation where, you know, food establishment, right, it's not necessarily just a sit-down restaurant. And so this will explain kind of the differences. So I just wanted you to have that, because again, it's one of those things you would never know if, you know, you didn't have this. So, I'm sorry. Okay, that's okay. So risk type ones, so there were 2, risk type 2s, 5, 3s and 4s. So most sit-down restaurants are 3s, just to give you an idea. A 4 might be like a sushi place or something, you know. One's right, typically convenience stores with prepackaged foods. Two's, it's kind of somewhere in between, the ones and threes, obviously, that doesn't give you a good explanation, but it can vary, so a grocery store could be a risk 3 if they have like a hot food bar, but the sushi counter is a risk 4. So it's not always that straightforward. So we did one pre-operational review, and I'm sorry, I don't know what restaurant it was for. You all may know. What
What's
it
the
was
tea
for.
shop?
Tea shop, okay.
It's on the detail here.
Yeah, okay,
Cozy tea law.
right, okay, it's right here. Let's see, so then everything else pretty self-explanatory. So there were no re-inspections, that's good. And that means no, issues. One lead case, one inspection at the soon to be determined whether it was the pet shop or the grooming site. I will find out.
It was Petco. It was the food store. Petco.
Petco, okay.
Yeah.
And septics, do you have any septics in town? Or-
Not
I'm
aware.
not aware of any.
Okay. Not that we know of, no, okay. All right, so then I'll probably just take that off your report. So under other, the site plan review, these are those sort of random things that we get just kind of on the department head listserv. So, we take a quick look just to make sure there's nothing. And then inquiries are, so I asked before I left, because I looked at this, I'm like, what does inquiries mean exactly? So this could be Mary calling us and we have a long discussion about something, whether it really is a complaint or not a complaint. Right, it could be talking to a resident about a potential complaint that doesn't turn into a complaint. So we didn't double count them in with the complaints. It's just kind of conversations.
And could you also have them like one of our school nurses?
It could be, yeah, it could be, but that would be probably on the nursing, would be captured in nursing.
Oh, okay.
This is just strictly environmental.
Oh,
Strictly environmental.
The question on, so
Mhm.
one of the things we get a lot of questions about,
Mhm.
rather than I see of rodents and insects, we hear about
Right.
wildlife a lot.
Okay, like deeper.
Right, exactly. So someone's feeding the wildlife,
Mhm.
something's getting into the garbage cans. Where is the split between code enforcement and public health?
Mhm.
In
Right.
terms of, wildlife versus rodents versus
Right.
animal control? Yeah, so.
Yeah. So who is the animal control contract?
The
Okay. All right.
township, not just one guy.
Okay. I will find out. I don't know, honestly. I don't
Yeah, it would be just
yeah.
another interesting
Yeah,
one. of
yeah.
Which box does this fall into?
Yeah,
We do
yeah.
get more wildlife than, I don't know, significant issues with rodents that we've received complaints about,
Mhm.
but certainly wildlife we hear about all the time.
Okay.
I'm just also curious,
Mhm.
if you
Sure.
could provide more color to what classifies as noxious weeds. I appreciate that you didn't have any complaints.
Mhm.
What are these like poisonous plants, or like what are we talking about in terms of noxious weeds?
Right.
And also the nuisance other category, because we did have some complaints there, and nuisance is incredibly broad.
Right,
So, and as is other.
Yeah.
So.
That doesn't make it any easier. I just
Yeah.
need to figure it out. I'm guessing the noxious weeds is just like overgrown weeds, but I'll find
We're
out.
thinking
That's
like poison
typically
ivy or something like that, because I'm curious where that,
Mhm.
again, that divide is with code enforcement and board of
right,
health.
right.
I can jump in there.
Please.
It's classified as
Okay.
poison ivy, ragweed, those that contribute to allergies.
Oh, really? I mean, like,
Ragweed.
I get allergies all the time, so,
The biggie is ragweed, poison ivy.
got
I
it,
think
poison ivy.
it was a state code. Poison ivy and ragweed, which you adopted at some point. To make those.
Okay.
Mhm.
Okay. All right.
Okay, so it's essentially those provisions from that like 1960s or whatever.
Yeah.
Yeah, okay, so then I do understand the
Okay.
nuisance other category, because it's like everything in the universe. Okay.
Okay, so it's based on your code. Is that
Yes,
okay?
it's in the noxious weed control. Code
Okay.
from the state of New York.
Okay.
From like 1960 something.
Okay.
Not broken, don't fix it. All right, and then do we want to jump into the public health nursing?
Yeah, let's take a look at that. So, and if you have any feedback on how, if you don't like the format of the reporting or you want something additional, just pass that along. This is just kind of how the staff have been doing it, but open to suggestions and, we can change it. So distribution of guidance. So these are things we get sometimes from New Jersey Links or just from the Department of Health that Peggy, who's the nursing supervisor, director rather, will forward on to school nurses or childcare centers. As you can see, she kind of broke it into categories. Sometimes she sends it to the township. And so it's just simply a listing. So you can see what kinds of things are coming through.
Mayor, we have 10 more minutes left. You have
Okay.
a couple of public comment period.
Right.
We have one resolution.
Okay.
And I need to resolve for you the board president. You can't assume it would be the mayor. The board needs to decide on the board president and secretary, which will get handled getting in this.
Okay, then I was asked if there's any specific questions, if anyone
Okay.
wants to review the public health and nursing report, just before we move on to business items, we are time limited.
Okay.
So,
That's fine.
no, he's keeping us on task.
But I do appreciate you
Yeah.
taking the time this evening, and I look
Of
forward
course.
to the follow-up on some of those questions.
Yeah, absolutely.
clarifications. So, and we should do this again sometime.
Yes, that sounds good.
It's been wonderful.
Yes, this, like we said, this has been deliberately a focus of ours, so it's very good to get the formal process.
Good. No, I'm happy to be here.
All right, so then,
Thank you.
yeah, thank you. So we'll go to public comment for local board of health questions only. Sorry,
Yes, I'm sorry.
please go ahead.
I wanted.
Yep.
Next
And
time I'll take.
I just want-
Okay.
okay,
Give you a.
sorry. Anyone from the public wishing on the health. Attending by pressing the raise button on your monitor and if you're dialing by *9. Once you're advised or recognized. Name, Township of. You'll have 4. Time they. Eat public comment, but after everyone. Respond or questions. Yeah.
We do have one question. Bring them in. Just your name and city of residence.
I'm sorry, I'm 30th Avenue in Verona. I'm a public health official, Karen Morris, what?
Right.
Your phone is breaking up really bad.
The audio is going in and out.
Right, you have kind of a really bad connection. I don't know if you're able to turn off any video on your phone or anything like that.
I can just say thank you. All right, we're done.
We received, I believe you might have sent us an email. We did receive that. We appreciate your comments very much. And we thank you for your attendance. So just want to make
Thank
sure
you.
we did do that. So thank you very much. If you have anything else, please just follow up. With me. Exactly.
I will, thank you.
All right, thank you so much.
Thank you.
Yeah, the second we did that.
The thank yous are clear.
Yeah, exactly. It's nice to be appreciated. Anyone else? Okay, anyone in the room for the Board of Health only? Okay, I'll now close public comment. We do need to jump back into, I'm sorry, I did jump back over. We were in new business, so we do need to set our, we've received our quarterly report. We need to set our meeting dates. As Mr. Diarco advised, we do need to appoint officers to the board. So, so as far as the meeting dates, do we have any proposed meeting dates or do we simply want one?
I will, Mayor, send those to the board.
Okay. Just coincident quarterly to
It'll be
coincident
quarterly.
with the council meeting schedule.
Yes.
Okay,
Oh, okay.
any concerns? Yeah. Okay, and then we can,
It may be helpful, maybe this. Second meeting in quarter or the first meeting in quarter, something, so we kind of schedule, so we keep up with it rather than try to do them piecemeal.
right, yeah,
Sounds like.
all right, we'll come back and we can do that, you know.
So, but we will be provided with a proposed schedule, so we
Yes.
can look at that. Okay, thank you.
Right.
And will that be posted on our website?
Yes,
Okay, so you'll circulate it to all of us. We'll have an opportunity to voice any obvious objections or something like that, and then you'll ultimately end up posting that.
Thank you for going forward.
We have,
consistent with your meeting.
we have to appoint is it a chairperson of the Board of Health?
President.
President, okay.
I move to appoint the mayor as the president of the Board of Health.
I'll second that.
Mayor would gratefully accept the nomination if,
Okay,
uh,
do we need to vote?
You gotta close nominations.
I will now, are there any further nominations? I'll now close nominations for President of the Board of Health. We have one nomination, all in favor?
Aye.
Okay, I'll entertain nominations for Secretary of the Board of Health.
I nominate Joseph Biarco as secretary.
You can ask.
Does that have to be?
Yes.
Yes, we can. Well, I will deal with the minutes.
For-
Chris, for the-
Which means I.
Okay.
I can nominate the deputy.
I was just-
I nominate the mayor through the secretary.
I will second that nomination.
Great.
All, any further nominations?
Nomination.
All right, I will now close nominations. All in favor?
Aye. Okay.
Thank you,
Thank
Madam
you.
Secretary.
Yes.
All right,
Fine.
so we do have one resolution here, and I'll ask you to, if you would, please talk a little bit about, what's up.
Sure. So public health priority funding is something that existed, over 10 years ago that we used to get from the state. Local health departments would get kind of set money every year. It was appropriated in the state budget and then it would get funneled to the local health departments. Not sure exactly why it stopped. I guess just one of the budget cuts that happened. And so they're now proposing $10 million, which among all the municipalities won't be that much money when you divide it up, but it will be something consistent. The grant money has been great, but you don't know when it's going away. And there's often very specific deliverables attached to it. So it limits, what you can really do. So it would be great if you felt comfortable signing the resolution. We're trying to get all the boards of health within, the jurisdiction to sign. The county is going to send everything together down to the state. And the New Jersey Health Officer Association is also working with us to try to get this, passed.
So moved.
I have a motion for the resolution.
Second.
Do I have a second?
Second.
Any discussion on the resolution?
No, I think it's great to get grant funding, even if it's pennies when it's divided on, 565 municipalities.
Yeah, no.
Sets a precedent.
Yeah.
for coming in.
So it's great.
Yeah, no, anything else for sure.
On the resolution, Madam Clerk, please call the roll for the resolution.
Was Councilman.
No,
No.
Member-
Board member.
Yeah, board member, right, president,
Member, or are we commissioners, or are we're board
Board
members?
members.
Okay.
Member Holland,
Yes.
member Kim Morrow,
Yes.
member McAvoy,
Yes.
secretary
Yes.
and president.
Yes, that sounds great.
23-01H.
Wait a minute.
Second.
All in favor? Aye.
Aye.
Right.
All right, thank you very much. All right, thank you very much. Happy to-
thank you.